Brian Wagner is one of the 900 amputee patients from the wars in Afghanistan and Iraq. Most injuries can be treated quickly, but there are some haunting side effects. Wagner was injured by an IED while serving in Iraq. He lost part of his right leg, but the pains linger.
I feel like I was getting stabbed like in between my toes, like with like a knife, like like a poker, or in the arch of my foot or the heel. The more like annoying ones are like when your big toe's crossed over your second toe, or like when you cut your toenails. There's like a little sharp spot. And you put a sock on it, like pulls your toenail back like that.
Phantom pain in general will dissipate over several month period, but in some people it actually lasts for years to decades.
The cause of phantom limb pain is still unknown, but there is new treatment to make this pain go away.
What we've been offering to some of the patients in our clinic here is something called mirror therapy. At the beginning of therapy, they take off their shoe and their sock and then place the mirror between the legs and then move the foot sort of up and down like they're stepping on the gas pedal and lifting off.
It literally feels like you're moving your foot. Like it feels like your foot is there, like the reflection and just the way you move it and everything. It's nuts.
When the patient uses the mirror and looks into it and sees the reflected image of their intact hand or foot, they think that it is the amputated hand or foot returned. By doing the movements, you're basically either quieting down excess activity in the brain, which may be generating the phantom limb, or you may be wiping away any bad memories of that limb.
Veterans say the treatment is working. Mirror therapy is now offered routinely to lower limb amputees at Walter Reed. Dr. Zhao says it may work better than conventional pain medication for people who want to stay active.
So we're convinced that the mirror is what is actually treating the pain, and it's the visual component of this therapy that's actually modulating pain response. You have young men and women, and they were very active before their injury, and so you want to get them back to the point where they actually can do everything they did before and hopefully even more.
Wagner says he's almost there.
After I got it cut off, I was worried about that. I couldn't do all the things I used to do. But then once I started getting more active and I don't know, I've never stopped.
And Wagner says he won't stop anytime soon. From Washington, I'm Walter Morris.
Yeah, exactly. Maybe we should go get the still photographers right now.